All right, let's talk about ACS scalp preparation for your FUE or PUE procedure. This is a technique that's incorporated with our micro PUE procedure because it is fundamentally beneficial to everybody. And it's also included individual techniques because if you get the standard FUE, it's something that happens outside the procedure, before the procedure, that you can get separately, and it has value in certain cases. But overall, I've only seen benefit from this technique, and that's why we put it into micro itself. So what is ACS? ACS is autologous conditioned serum. It's our version of an elevated PRP. Remember, it is using growth factors that exist in your blood for wound healing that lead to skin and hair cell growth and new blood vessel growth that can lead to non-surgical rejuvenation of the hairs. And in PRP, you take the blood, you spin it down, you burst all the cells, release these growth factors, and you just inject them. And because there's so many growth factors around, people tend to get better hair restoration results non-surgically. In our case, we started doing this prior to surgery for a couple of reasons. Number one, if you just assume these hairs have to be transferred into skin, and these hairs, once they're outside the body, are dead. They have to reincorporate within the body within about 24, 48 hours to get nutrients, and then over 5 to 10 days to get real blood flow in order to survive. Well, if that hair is not prepped to handle hairs in general, or if that skin they're putting the hairs into is not ready to accept hairs because it's been compromised, those grafts won't survive. Or if you take even normal skin and you try to put a lot of grafts into it and it's not there ready to support all those grafts, you may have a problem. So we can actually prep that skin. Now, we use ACS, we don't use PRP. In ACS, instead of trying to process the blood and rupture those cells, we actually maintain the cells involved with wound healing. And we actually want the real wound healing process to occur. And why is it important? Because in real wound healing, what are the steps that need to happen? Number one, you need new blood vessels to grow to support nutrients to that wound, to allow it to have the building blocks it needs to regrow. Second is you need cells to interact to signal other cells and release growth factors to start the wound healing process, which is the replication of skin and hair cells and then lay down deposition of collagen. So ACS actually maintains the cells, it doesn't rupture them, and it causes a real wound healing process in the scalp. And what it does is actually revs up the skin such that it can support these hairs a lot better. So when do we want to do this? Well, if we're doing a normal procedure with a normal number of grafts, we want to do this in people who had previous surgery. If you had a previous hair transplantation in an area, you no longer just have skin, hair, and blood vessels anymore in there. You have skin, hair, blood vessels, and scar. So the new blood vessels are going to have a harder time growing in. If you have older, mature skin or that's been sun damaged, over time, the vascularity of the scalp will actually start to disintegrate. It won't be as supportive. Or if you've been missing hairs in that scalp for a long period of time, the blood supply is decreased because the body no longer has a need for it. You may need to be, may want to ramp up that blood supply for a normal amount of grafts to go into it. Now, let's say you have normal skin, but you're doing a huge amount of grafts. You want really, really high density hairlines because you have thin, dark, straight hairs, and we need a lot of grafts in there to create the density we want. Well, we can actually ramp up the vascular bed of normal skin to accept more hairs. It means more incisions we can make in the skin, allow it to support more hairs after the transfer to get ready. And that's why it's been beneficial to essentially every patient that's come in. Like there is a reason to prep the skin, and no matter what case you do. Obviously, there's cases where you want to definitely do it, and that's why it's an option in standard, but it's just built into micro because we've seen better results overall. The one endpoint that I can see being true almost every single time is we normally see growth between 4 and 9 months after procedure. With these preps, we've been seeing growth as early as 6 weeks. That means that these hairs have just been supported as soon as they get into the scalp and they begin their growth process much sooner.